Welcome back, everybody, to Midday. I'm joined now by Dr. Stephanie Henderson. She is from Granger Medical Clinic, and she specializes in women's health. There's been so much talk lately, Dr. Henderson, about minimally invasive surgery. This is actually one of your specialties. Tell us more about it.
So in many different specialties, minimally invasive surgery has become the standard of care. Traditionally in gynecology, for example, when a woman needed a hysterectomy, she had a large incision on her abdomen, she stayed in the hospital for 3-4 days, and then had a long 6-week prolonged recovery. Now with the technology we have, we can offer a minimally invasive approach to surgery.
So what does that mean exactly?
So small incisions in the abdomen. So a small incision in the belly button and 2 or 3 additional incisions, and we do all our surgery through those small incisions. Patients go home the same day and they have a quick recovery.
So it's a completely different type of training for you, I would think.
Absolutely. So a fellowship-trained minimally invasive GYN surgeon like myself has gone through an additional 2 years of fellowship in order to do these complex procedures and to offer them robotically, vaginally, laparoscopically as well.
Because look at the screen right now, Dr. Henderson. This is what you're using for surgery.
Absolutely. These are robotic instruments, and these go through less than a centimeter-sized trocar. We do all of our procedure through with these small little instruments, through small little incisions, and I operate these instruments through a console at the patient's bedside.
Wow. You mentioned a couple different things that you treat, a couple different diseases. Mention those again.
So women's health, anything that has to do with women's health, with women's reproductive health. So we're talking abnormal heavy bleeding with your periods, uterine fibroids, pelvic pain, endometriosis, prolapse, incontinence, discharge, lots of things that are common with women, but we just don't talk about.
So besides the scarring, which I think we all know someone, or maybe we've been through it ourselves, with a large scar from surgery, besides that, what is the benefit of having just that minimally invasive surgery?
Lots of benefits to a minimally invasive approach, including decreased complications. So decreased blood loss, decreased rates of infection, decreased hospital stay. Most times patients can go home the same day. So same-day discharge, and then their quicker recovery to their work and school and normal activities.
It's completely high-tech.
It is, but it's also, it's also low-tech too. So our the longest thing we've ever done for a hysterectomy approach, for example, is a vaginal hysterectomy. And that is still the standard of care for a minimally invasive approach. But for a lot of patients who have more complex problems, like a large uterus or a lot of scarring from previous surgeries, if we can offer a laparoscopic or a robotic approach, we can save them a lot of complications.
Dr. Henderson, what's the benefit of a surgery performed by someone like you who's been fellowship trained to do this?
Well, any surgeon you're looking for, whether it's for your eyes or your heart or for anything, you want someone who's been doing that exclusively and who's done a lot. We know that high-volume surgeons have lower rates of complications, and they're able to care for more complex patients. So the benefit of a fellowship-trained minimally invasive surgeon is you get that expertise and that ability to kind of treat things that are just kind of outside the norm for most providers.
When you're in that position, you want to feel comfortable, and like the doctor you're with knows exactly how to take care of you.
Absolutely.
She is brand new, by the way, everyone, at Granger Medical Clinic, and you are accepting new patients?
We're accepting all insurances. We're accepting all new patients. Murray Women's Health is a unique office because we have all women providers, nurse practitioners, and physicians, and all we treat is women's health. So it's a great place if you have a women's health related issue to come for your pap smears or for a problem visit like this.
Well, so informative and so easy to talk to. Ladies, that's the key, right? Go to our website for all the information about Granger Medical Clinic. That is their website right there. We can link you if you go to goodforutah.com/midday. Dr. Henderson, thank you again.
Thank you so much for having me.
And we'll be right back.